There are actually several new treatments presented here at NANETS that are really focused on tumor control for patients with neuroendocrine tumors. One of those was a phase 2 study of cabozantinib, which is a new tyrosine kinase inhibitor. It targets both the VEGF receptor and c-MET. Phase 2 studies showed really encouraging results, and based on those results, cabozantinib is going to be taken forward into a very large randomized study that is really designed as a registration study, and hopefully will be yet another new treatment for patients with neuroendocrine tumors. Other new treatments that were presented here included a new drug that people may not have heard so much about, a drug called Zedra. This is a drug that is designed for patients with a relatively rare form of neuroendocrine tumor called pheochromocytoma paraganglioma. And there are very, very few treatments available for these patients. So Zedra is a new form presented here, showed really encouraging activity, and hopefully that will also move forward and represent a new treatment option for patients with metastatic pheochromocytoma paraganglioma. Finally, you had mentioned PRT. So many people are already aware of the registration study that was published in the New England Journal and showed really very encouraging results, clearly demonstrating that peptide receptor radiotherapy, a drug called Lutathera, improves progression-free survival. And what we heard here was really more confirmatory data. One example suggesting that Lutathera really does help patients. It helps preserve their quality of life, which is clearly an important aspect for patients who are suffering from this disease. A second study involving Lutathera showed that it can even be given if patients have responded to the first few rounds of Lutathera, and then the tumors start to grow again. It can be given, at least in some patients, safely for a second time, so that may represent an option for patients as well. So we're hearing really some new things about Lutathera as well.